Thanks very much, Paul. And yes, it's a beautiful, beautiful spring day here in Tokyo, 22 degrees. It's absolutely glorious. So you're able to hear me, everybody, I hope? Thumbs up from those people in the front. I can see you. Thank you so much. That's great. So welcome, and also just I'm heading off now into the Tokyo arena to explain to you about the vaccine rollout here, a little bit about the Olympics. So let me just set the stage. I want to just go back to January last year. The cruise ship, the Diamond Princess, was docked in Yokohama, and with more than 700 of the 3,711 passengers on board infected, and 14 people had passed away. So at that time, Japan was feared to be the scene of the next big outbreak of the virus. 57% of Japanese at that time were unhappy with the coronavirus response. But by early summer, that's July 2020 up here in Northern Hemisphere, Japan was then seen as the poster child for its approach to the pandemic. Unlike many other countries, including New Zealand, Japan attracted world notice for not imposing a lockdown, but rather just applying this strong yet polite request to the people of Japan to stay home, wear masks, etc. It was said that that kind of minimized the COVID-19 related deaths without really introducing this strict lockdown, without broad testing policy, and instead pursuing a cluster-focused approach. Even though much of Western media severely criticised Japan's failure to lock down and failure to test asymptomatic people here, and they also predicted mass deaths, but that didn't happen. So why was this, and why were the powers of Japan, the government here, limited? It's really important to think about the historical context here, dating back to World War II, post-World War II. Japan stepped back from its real stronger enforcement of enforcement steps that it had done throughout World War II. That changed because post-war, the US drafted constitution protected the rights of freedom of individuals, and that was enshrined in the constitution. And so now even politicians and the public are very wary of those far-reaching government powers. And so that's meant the Japanese government, all they can do under a state of emergency here, it sounds horrific, state of emergency, but actually all they can do is strongly request the cooperation of citizens and urge them to follow the recommendations. That's it. So pretty much there were no restrictions on residents' movements aside from asking us not to go out unless we were shopping for food or an emergency. We had no high-tech apps tracking our movements. Businesses were asked to have 70% of their workforce at home. Restaurants and hairdressers basically stayed open. I personally went to the hairdresser, vanity rules in my way, every month. And I was really the only person in the salon at the time with one other salon person, the same person each time I went. So why did Japan do so well to contain the virus compared to other countries? Well, there has been one widely shared list of reasons assembled, and maybe many of you have read this, and together there have been 43 reasons raised why Japan did so well. And one was the culture of mask wearing that's already here. Greetings are by bowing rather than handshaking. Resistance to hugging and close contact, thank goodness. And famously low obesity rate has also helped. And also people like me who wear glasses, apparently this has also been a reason put forward, as well as the relatively early decision to close the schools. Among some of the more fanciful suggestions, sometimes it has been claimed that Japanese speakers emit fewer potentially virus-laden droplets when they talk compared to us Kiwis and other English speakers in the world. So that's interesting. And experts also have credited this easy to understand messaging that went out with lots of diagrams and cute sort of manga characters to talk about the 3 C's: avoiding close spaces, avoiding crowded spaces, avoiding close contact. So rather than saying staying away from people entirely. So Japan's relative early success in this pandemic did really mean, though, that an urgent rollout of this shot, the vaccine shot, has been less of a priority. So where are we with the numbers? If you've got your pen and paper handy, I'm going to give you the latest statistics on the numbers. According to Reuters COVID-19 tracker, the all Japan average of new infections is 1,792 a day. Yesterday's Tokyo total was 332. That's new infections in one day. Osaka is on the incline at 432 a day. It's a month since it went over the 400 number. And in Japan yesterday in total, 2,087 cases, 368 of which are COVID severe patients. We also received a new statistic today that 1.35% of the population has the COVID-19 antibody in their body system. So in total, there have been 470,000 odd infections and 9,000 coronavirus-related deaths reported in Japan since the beginning of the pandemic. 200,000 of those, around about half, are in the Tokyo metropolitan area. And yesterday, the first variant virus death occurred in a 70-year-old man in Osaka who had not been overseas. So compared to New Zealand, these statistics seem high. Compared to US or Brazil, these seem pretty low. And so for balance and perspective, I do think it's worth noting that more Japanese people in last year, 2020, died from 25 other causes than from COVID-19. COVID-19 accounted for only 0.3% of all deaths in Japan. There were 7 times more suicides in Japan. There were 40 times more people who died from flu and pneumonia. More people, in fact, died on the roads, since many people resorted to traveling by car instead of going in the crowded trains. So Japan was really one of the very few countries without an excess mortality caused by COVID-19. So let's talk about the vaccine rollout. On February the 15th, Japan began the rollout of the Pfizer vaccine for healthcare workers. So the rollout of the vaccine has really only been in play for the last 6.5 weeks. And Japan's rollout is really later than most other major economies, and it's really dependent on that Pfizer vaccine coming into the country. To date, Japan has administered 822,869 doses of the COVID vaccine. Assuming that everybody here needs 2 doses, that's enough to have vaccinated just 0.3% of the population. Remember, the population of Japan is 125 million. So this data is based on the number of doses, right? It's not the number of people who have been vaccinated. So just be careful of that. So in the last week, Japan has averaged 45,400 doses each day being administered. So at that rate, unfortunately, it's going to take another 500 odd days to administer enough doses to just get to 10% of the population being vaccinated. So we could say that Japan's doing actually pretty bad, ranked 100 in the world for having less than 1% of the population receiving the vaccination, compared to, say, the US, which is 27%, even Singapore, one of our closest neighbours here, at 14%. So indeed, to someone like me, the average person here, it really feels glacial in the pace. And I'm just waiting for the vaccine coupon to arrive in the post from the ward office. The ward office is like your local city council. The vaccine distribution here is managed by that city council ward office. And one of my Japanese friends said to me last week, the ward offices are so disorganized and so incompetent. It took them ages to organize the subsidy payouts last year, and the application process was really complicated. So for the vaccine rollout, there's really quite a lack of confidence here that how they will do it. Also, public skepticism towards vaccination could also hamper Japan's rollout. Only 63% of Japanese who responded to a poll last month said they wanted to be inoculated. 27%, upwards of 27%, said they don't want to be inoculated. So as I just said, health workers are the first to get the vaccination. Let me just tell you that there are 4.5 million healthcare workers in Japan, right? We're looking at the New Zealand population, basically, that have to be vaccinated first. And after the healthcare workers have been vaccinated, then from April 12th, in another 12 days, Japan will move into the second stage and start vaccinating the over 65s. Prime Minister Suga jumped the queue and received his first dose of the vaccine 2 weeks ago on March 16th. He's being vaccinated as part of his preparations to go to the United States in April, where he's going to be the first world leader to meet with President Joe Biden. So after he received the shot in front of cameras, clicking, and took his cue from other world leaders who have had, used this as an opportunity, obviously, to try and build confidence in getting the vaccine. And he was quoted as saying, "It didn't hurt, it went smoothly." So that was widely reported. So what about the rest of us? When is it my turn? When is it our turn to get the vaccine? Many of you know, obviously, that Japan has an aging population and that Japanese people generally live longer. But you will be astounded, perhaps, as I was, to learn that Japan has 35 million people who are over 65 years of age. Think about that. That means that second stage is going to be continuing for a long period until this kind of universal eligibility, as it's called, people like me can get the vaccine. So we have an app here where you can enter your age and your location in Tokyo or in other parts of Japan and find out when you're up for the vaccine. So I entered my much younger than 65, I hasten to add, age into the app and my location in Tokyo, and it told me that it would be 8 months. So that means September at the earliest for me, all things being equal, to get the vaccine. I am happy to say that beyond Pfizer, Japan is looking at having shots developed by AstraZeneca and Moderna. They are also in regulatory approval process at the moment. And the government has arranged to apply for and receive 120 million doses of the AstraZeneca vaccine, which actually will be made in Japan by domestic drug makers, because that doesn't need to be stored at the ultra cold temperatures for the Pfizer formula. So, I said before we had been in a state of emergency. That was lifted on the 21st of March. And according to data that came out from the New Zealand Embassy in Tokyo, this extension of the state of emergency, which occurred through to March 21st, actually caused a 9 billion New Zealand dollar drop in consumer spending. It was pretty modest, really, the state of emergency, primarily calling for people to stop drinking and eating after 8 o'clock at night in establishments. It was clearly effective. The number of infections in January, after people had gone on holiday for the new year, was up at 8,000 cases a day, 8,000 cases a day. And that's now come down to that 1,000 odd that I mentioned before. And Japan's continued this tight border settings to try and curb the risk of importing the virus. They've suspended the short-term business travel between Japan and other Asian countries, as Clinton will know when he speaks. And that's always just to bring down the numbers as much as possible. Japan has, however, indicated that they're going to have a digital vaccine passport introduced, which is quite revolutionary. So as you can tell from what I'm saying tonight there for all of you, that progress has been pretty slow here. The lack of the vaccine doses, the associated equipment. Not only that, we've only got certain doctors and nurses who are allowed to administer the vaccine, and only certain hospitals as well. And again, not only those factors, you also need to understand a historical context in Japan. Japan is really very, very cautious about vaccines. Historically, there have been issues of potential side effects. The government was involved in several lawsuits relating to the issue. And that just adds to this deep caution that Japan has got, and the kind of skeptical attitude that's been around in Japan before this so-called recent anti-vax sentiment. It's been in Japan a lot longer. People here are still keeping to wearing masks, but in this last week, I talked about just before how wonderful the weather is in Tokyo. We've just had, at the end of the hanami, or cherry blossom viewing season. And that usually consists of people sitting under cherry trees, eating and drinking and having lots of fun. So although the trees were cordoned off and signs were around no drinking and eating, there's a sense of fatigue in Japan, and people did go and actually sit under the trees and resisted those rules not to. So many are just saying that they're just so tired of restraining. So most of us continue, though, to be good citizens and restrain as a fourth wave here is predicted, as the numbers have really seen an uptick in this last month. So finally, what about the Olympics? So Vaccine Minister Taro Kono said last Monday that he expects to have 10 million doses of vaccines in each week of May. He's pledged to have enough doses in the country for 125 million people by the end of June. That's before the Tokyo Olympics starts on July 23rd. So hurrah, we can say that we've got enough doses, but that doesn't mean everyone's going to be inoculated by the time of the Olympics, right? We've got the doses in place, but not everyone's going to have it. The Olympic torch relay started this last week, and there's a ban on standing on the sidelines and encouraging runners by yelling out. We can only clap and use signboards. But having seen the images on TV, there is a lack of social distancing, and I, for one, am pretty concerned that when the torch comes to Tokyo, I won't be out on the sidelines, unfortunately, watching. As I said, cases have upticked recently, and Osaka governor has said there's an impending fourth wave, he thinks, in Osaka, and two smaller populated regions in Japan went into state of emergency this week because their numbers have gone up. So rumours have it that there will be another state of emergency just before the Olympics to again bring down the numbers. Prime Minister Suga has invited President Biden to the Olympics in Tokyo. So all of the signs here are pointing towards the Olympics going ahead. Indeed, the New Zealand Olympic team is preparing to come here and are working on vaccinations. So to sum up, I think Japan is determined for the Olympics to go ahead. They want to be a beacon of light as a country for humanity. How the athletes and volunteers are going to be looked after in their bubbles is yet to be determined. But I know that if a country in the world can do the Olympics in this kind of situation, Japan can. When she sets her mind to something, Japan really comes through. So I'll leave it there for everyone.